in the sense last couple of months, we have covered an entire thing about total hip replacement, basically building the concepts about total hip replacement starting from uh, biomechanics, cemented, uncemented, complications, failure, mechanism, everything. So, good evening, friends. Today onwards, we'll be speaking about knee series. Okay, and starting with the knee series, the most commonly performed surgery, that is total knee replacement. From today onwards, we'll be discussing about this thing, right? Okay. So, good evening. Good evening again. So, the hip, I think we had covered everything about the hip except for complex cases and the revision cases. That is little advanced kind of thing. Uh, Basically, my idea was to get into the concepts. Okay, once the basics and the concepts is right, you can build upon the things. If you have understood the concepts properly, either it can be primary, it can be revision, or any complex primary cases, you can manage it very well. So with this background, with this mentality, I have started this series. So we covered about 8 to 10 lectures about hip, and now we'll be speaking about knee. Okay, so knee, many of us do TKRs. Okay, so I want to be little interactive. Okay, so what do you want to do for this case? Anyone? Anyone? Any takers? Any takers? 65 years old female, complaints of pain and difficulty to perform daily activity. Any takers? Anyone? Mic rights, you please raise your hands. We'll get you. We will give the mic rights. ठीक है, interactive होना चाहिए. 65 years old female presented with the knee pain and unable. She's finding it very difficult to perform her daily activity. So what do you want to do for this case? Any takers? Okay.
Yes,
Please,
Alazar, you can take. Rashna,
please
where
give
you
the
can
mic.
mute Alazar?
Okay,
Yes,
greetings, sir.
Alazar, you can take.
Yeah, Dr. Lazar, please go ahead.
Yeah, so this is a 65-year-old female who is symptomatic. X-ray shows medial joint space narrowing with some subchondral cysts. So this is a
Okay.
classical osteoarthritis. So I'll probably start with conservative management
Okay.
to improve her knee range of motion as well as some quad strengthening exercises. I'll also
Okay.
manage the pain with NSAIDs and frequent steroid injection. And then if
Okay.
she's not improving, I'll probably go for total.
Total knee replacement. Okay.
Yes, sir.
So, according to Dr. Alazar, he said he pointed out all the findings that patient is having decreased joint space. Okay. There is cyst, there is sclerosis. Okay. There are some osteophytes. So this is a case of osteoarthritis. So if conservative fails, then we'll plan for TKR. Okay, fine, agreed. That is what has been told to us. That is what has been taught to us. Okay, let us start analyzing few things. Okay, consider this case. I'll get back to that story. So this patient underwent. Continuing to that part of the story, we did what Dr. Alazar said. Okay, we managed with conservative management. Okay, with analgesics, NSAIDs, everything. Okay, even then we did TKR. The patient is still unhappy. This is 2.5 years. This is actual patient which I have seen. This is 2.5 years from the TKR. The patient is still unhappy. Okay, we did the TKR. We thought TKR is the end solution by giving all the treatment, but the TKR is unhappy. Next, moving on to this part. Similar case, okay, presented with this. Again, Dr. Alazar, there is decrease in joint space. There is osteophyte formation. Okay, we did TKR. Okay, but still the patient was unhappy. Okay, the alignment was good. The balancing was good. Everything was good. But still the patient remains to be unhappy. Okay, so once we start now, can you see this? Can you see this? This, and what has been done here? So what has been done here? They did perfect TKR, but the patella was not replaced. Okay, but the patella was not replaced, landed up in being a painful TKR again. The purpose of TKR has not been served. Okay. So moving on to this, again, same story. This patient also underwent TKR. Okay, this patient also underwent TKR, but still the pain is persisting and the patient is unhappy. So my question is this the indication for TKR? Pain and inability to do the activities of daily living? Is this an indication for doing a TKR? How many yes, how many no? Please go ahead, Dr. Alazar.
Yes, sir. So an indication would be end-stage arthritis, which has failed conservative treatment.
Okay. So if the conservative treatment fails, we'll plan for TKR. TKR is the end solution. Okay. The symptoms being pain and inability to do the daily activity. Okay. Have you noticed? Okay, we'll move on to the next thing. Okay, this patient had pain, same, inability to do daily activity of living is affected. Along with that, on examination, we found instability. Okay, this patient was very happy walking with TKR at 3 months, at 3 years. In fact, this lady got us another 5 to 6 patients. Same symptoms, pain, inability to perform her daily activity. But still, this patient ended up being an happy TKR.